that's why the medical system is broken, because the
Mm.
insurance companies now dictate what tests you can get. And back then with HMOs, because I trained in an HMO residency, you cannot order tests. Like a headache, they have to come back so many times and you have to rule out so many hoops to jump over because they don't want to spend the money
Wow.
to
Wow.
pay for the test. So they are, and basically, if doctors try to go against it, they are turned down by the insurance companies. Insurance companies pay hospitals. Hospitals are not going to take the bill because they
Wow.
can't stay solvent if they are doing stuff for free. So then either you pay for it yourself. But this is why it's so important to have a second opinion, a consult from a physician like myself who offer that,
Yeah.
where you can say, hey, I have my daughter, she keeps having headaches. What's the next step, Dr. Jones? What do we need to do?
Yeah.
Because then in that case, you may have to go around the system. And
Mhm.
think about it. The cost where you pay out your pocket,
Is
is
very
that really more than the amount of suffering and the years?
Yep.
You
Let's
see what
talk
I'm
about
saying? So
that.
sometimes it's worth the $1,000,
Yeah.
even if you don't have it. You know, I've had people to go and take a mortgage out on their house to
Mm.
get the test to be adequately diagnosed. Is that right? No, that's awful that we're in a country
Mm.
that treats us like this.
Mhm.
Mm, wow. And then you add on top of that what, with the cuts that they're making to student loans and
Yes,
the limits, and then people, a lot of, especially Black people, are not going to be able to become
to
physicians.
go to become physicians, right?
And we need that in our community because studies show that people who go to Black people who go to Black doctors live longer. They're diagnosed
Right.
better. They have better health care, better health. Wow. Okay. Dr. Deborah,
Yes,
have you been in a situation where you've been misdiagnosed?
absolutely. Actually, about 7 months ago, I
Mm.
was diagnosed with a collagen vascular disease. And I went through a lot of panicking. And then I utilized the resources in our network, Dr. Shirley Jones. And I called her and gave her my blood work, gave her the diagnosis. And she instructed me. She had consulted me and told me what to do and why I did not have this disease because the indicators did not line up.